So good afternoon. I am Sam from the Philippines, and we would like to thank the OIE for the opportunity to be able to present our campaign on AMR. I am today with our director, the director of the Beer Animal Industry, Dr. Ronnie Domingo, as well as the National Program Coordinator for the FAO BAI AMR project. So our presentation is, sorry, I am responsible, imparting a sense of accountability, ownership, and responsibility among stakeholders in the fight against AMR. But first I have to make this work. Okay, so let me show you a few statistics about the Philippines at a glance. So 53.76% of the country's total production is from crops, okay? And 32.89% is on livestock. The hog industry being 16.96%, as well as the poultry being 15.93%. And workers on agriculture comprise the second largest group, making up 25.4%, that is in 2017. Then 13.36% of the total production is from fisheries. So this gives you an idea of what agriculture in the Philippines is. And you can see our map. We have an archipelagic nature. We are an archipelago of 1,700, more than 1,700 islands, okay? So for the swine sector, it is the most important, or let's say the top protein source of the country, okay? So we are very, very heavy pork eaters, and historically, it increases annual per capita consumption at 15.7%. And most of these, let's say around 60 to 70 to 80% of this is in the backyard areas. And for the poultry sector, this is the second most popular meat in the Philippines. And it follows pork at an annual per capita consumption of 8.26% kilograms. And also in the Philippines, we are a country of 187 languages. And this map only shows 10 major languages, okay? We are also a growing population of 100, or roughly more than 100 million people, with internet users at 8 million, and the literacy rate is 9 out of 10. So it's approximately 93 million people literate. Okay, so we go to what we are doing currently on AMR. The background of AMR in the Philippines is that we have been working intersectorally. We have been working with the Department of Health on AMR, and we do have an interagency committee on AMR. It's called the iCAMR, which is chaired by the Department of Agriculture as well as the Department of Health. And this is responsible for crafting the Philippine Action Plan on to combat AMR. And it says here, One Health Approach. Okay, so the Philippine Action Plan was launched in November 2015 during the first AMR Summit in 2015, during the 2015 World Antibiotics Awareness Week, and there's an emphasis on working together. It is interrelated, intersectoral, and it requires collaborative multidisciplinary work at the local, national, as well as global levels. So we are in line with the global strategies. This is the Philippine Action Plan. Actually, the cover there, what you see is the old plan from 2015 to 2017. However, this, we are in the process of strategizing and crafting the 2019 to 2023 plan with the Department of Health as well as the World Health Organization. And these are the KS, means the key strategies that we are employing. And you see here, Key Strategy 7 is improvedness of awareness and understanding of AMR through effective communication as well as education. Okay. However, you can see some highlighted things here also. Increased strategy 1, you could see multi-sectoral engagement. So you could see that communication is in every key strategy. It is essential in every key strategy. So the Department of Agriculture, with this work, the DA Technical Working Group, the Department of Agriculture Technical Working Group and AMR, is responsible for implementing the livestock sector of it, the livestock component of the National Action Plan. So this is created by a DA special order, and it is originally composed of the BAI, which I represent, the National Meat Inspection Service, NDA, the PCC, the Bureau of Fisheries and Aquatic Resources. However, recently we have reconstituted this group to include more of the concerned Department of Agriculture agencies and more private sector, okay? More private sector involvement. So during a strategic planning workshop that we did in February 2018, with the help of the FAO, we were able to gather all the regional AMR coordinators as well as the DA technical working group people and discuss the different strategies which we need to concentrate on, because we have 7 key strategies, but given the limited funds and limited, a lot of things are limited. However, we have to strategize on concentrating on what we can do currently. So the topics discussed here is to concentrate on information, education, communication, and promotion and advocacy. However, because you see, whenever we do AMR activities, we ask people, the groups, the stakeholders, farmers, veterinarians, livestock inspectors, agricultural technicians, we ask them, please raise your hands, who has heard of AMR? So let's say half of the group raises their hands. Then we ask them, okay, next question, who is familiar with AMR? Who can talk about AMR? A few hands come up. And then we ask them, who is confident to discuss AMR? Even the technical people don't raise their hands. So this is, if the technical people are not very versed about AMR, how much more for our stakeholders in the general public? So this is why we have to focus on IEC. And we also have strategies on surveillance and monitoring and policy formulation, which I will quickly discuss before I go into communication. We do have an overall framework for the Philippine surveillance plan. We have this planned already with the private sector, which will cover AMR surveillance in pathogens in diseased animals, healthy food animals, as well as aquatic animals. We are also doing key strategy 4, regulation and promotion of rational use in AMR, wherein there's an ongoing review of the existing regulatory framework, because we really need to review our laws and our administrative orders in order for us to do AMR activities, because our regulations are very, very outdated. So this is which is why we want to do such reviews. And recently we worked with the OIE in a workshop to map antimicrobial use in animals. This was done in Manila very recently. So we now go to what we need to talk about today, which is communication. Key strategy 7 is improvement of awareness, understanding on AMR through effective communication and education. So we always should learn from best practices, okay? So one of the best practices that we are viewing is that what the Department of Health has been doing for the past years. These are some of the key communication messages of the Department of Health, which they distribute in the generics drugstores and the major drugstores. If you go 3 to 5 years back, you could buy an antibiotic in the drugstores, even the generics drugstores in the Philippines. However, now, if you go to a drugstore and ask for an antibiotic, they always ask for the prescription. It's required. You cannot do that. However, in the agriculture section, it's a different thing. You could go to a agri-vet supply, that's what we call it, the retail stores. Regardless of what you're wearing or you have money, or they just give you an antibiotic. That's the sad reality, which we should address. And we are planning to address this by doing a massive communication campaign coupled with monitoring, which the Department of Agriculture has done. And these are just examples of the key communication messages that they need. I just read out one. It says, alam mo ba nang ang simpleng ubo at sipuan ay kadalasang kusang gumagaling? It says, do you know that a simple cold will eventually cure itself without the use of antibiotics? So this is one of the key communication messages that they used and has been very effective, because now the people know about such things and they now come with a prescription. So with that view, we looked into, we need to make a key communication messages specific for livestock stakeholders. That's what we thought. And again, learning from the best practices, I have been honored, it's been my honor to be part of the National Foot and Mouth Disease Eradication Program in the Philippines, wherein public awareness was one of the pillars of the campaign. In fact, we had a mascot. We had the beacon. His name is Super Pig. And this mascot went around markets, spreading the word and spreading advocacy about foot and mouth disease. And in the end, towards the eradication phase of the Foot and Mouth Disease Task Force, the slogan or the battle cry was, "Karapatan mo ang karneng sigurado." It means, safe meat is your right. Okay? So this aimed to raise awareness among consumers that it is their right to have clean and safe meat, and of course, their right to demand from the government that to pass policies promoting clean and safe meat. So these are some of the best practices that we learned from in coming up with the communication strategy of the Philippines for AMR. So during a workshop on key communication messages, we were assisted by the FAO in coming up with key communication messages for our livestock sector. So this was done in April 2018, and we gathered all the regional coordinators as well as the different food safety regulatory agencies, and we came up with this. I am responsible. Okay, this is the very first draft of it, and it supports the development of key communication messages on prudent use of antimicrobials as well as the promotion of good animal husbandry practices. And the target is everyone. It targets veterinarians, practitioners, it targets farmers, it targets drug companies and retail, the retail, and the local government units as well as field personnel. And with the help of a visual company, we were able to make it look a bit better. Okay? So this is currently the draft of the I Am Responsible campaign. It shows the different commodities, because the challenge in our work is that we are multi-commodity, right? So we have to put in a carabao, you know it as a buffalo, but in the Philippines we call it carabao, a pig, a chicken, as well as fish, which covers all the commodities that we cover right now. And it is this campaign which says, I am responsible. A veterinarian or practitioner says that I am responsible, I prescribe antibiotics only when needed, with the right dose, the right drug, at the right time, at the right route, for the right species and for the right patient. And another message is that overuse and misuse of antibiotics causes AMR. Again, we target another audience, which is the farm owners. Usually the big problem about farm owners is withdrawal period in their farms, okay? So it is, I am responsible, proper withdrawal of antibiotics is observed in my farm. So you see it's the stakeholder or the target audience owning up to the problem, okay? Taking responsibility for the problem. Okay, so I apply good animal husbandry practices in my farm, and my farm practices prudent use of antibiotics. And of course, we also cover the different sectors which we continue to develop, the drug manufacturers, to share the responsibility on AMR. And of course, we, as I mentioned earlier, we are a country of various languages, so we try to put such messages in the local languages. And with these are the different drafts of what we have come up with. And finally, we have some posters, brochures, which we have targeted towards specific stakeholders. For instance, the first one shows overuse and misuse of antibiotics may lead to AMR. Again, the requirement of a diagnosis first and a prescription. And the next one shows again, the stakeholders owning the responsibility. A veterinarian saying, I am responsible, I prescribe only when needed. I am a backyard farmer, I follow this prescription. And the next one is, I am a commercial farmer, and I observe proper withdrawal of antibiotics and apply good animal husbandry practices. Okay? So another example is this time in the local language. So the first one is actually something I picked up during a training in France. It's similar, but we had to put a Filipino twist on it. It says, kapag alagay may sakit, hindi dapat automatic na antibiotic. So it says that if an animal is sick, it shouldn't be automatic that you give an antibiotic. There should be consultation or consulta at reseta muna. So consultation and prescription first. So that's what it says. And this is an acronym that we made up. Gamot, actually, G-A-M-O-T actually means medicine. So the various messages there encompass the different sectors of what we want to promote. Okay, so this is five ways of how you can become iAMResponsible. Okay, so these are just examples of the different where we would want. Where we are printing right now our campaign. We have T-shirts, brochures, pull-up posters, and the like, which we distribute to our regional coordinators. And yeah, you can visit us on Facebook. We are on Facebook. It's the iAMResponsible PH Facebook page, where we continuously update. And yeah, because social media is very, very powerful, as you know, so we need to be here as well. So the current collaborations, as I mentioned, the Department of Agriculture, particularly the beer animal industry, has a project with the Food and Agriculture Organization, and this has been, we are actually very grateful for the FAO for being able to stimulate activities on AMR in the Philippines and guiding us on how to align our strategies to the global strategy. And we also have been participating in the various regional good animal husbandry practices roadshows. These are done in the various regions in the Philippines. We have 16 different regions, and we have done the GAHAP roadshows in 12 of them, wherein we talk about AMR, and surprisingly, a lot of people, farmers, backyard farmers, commercial farmers, are very interested about AMR, and a lot of questions about AMR are asked during the open forum. So this is where this is part of our communication strategy. And we have conducted various regional orientations and stakeholder engagements in the different regions in the country. And we are, another best practice that we learned from the Foot and Mouth Disease Task Force, as well as the other task forces, is that we have to have a regional approach. Yes. Okay, so I'll go to the, we celebrate World Antibiotics Awareness Week every year. And this is where we have a show of force of the different agencies to support the campaign against AMR. And this year we are doing it in, during the World Antibiotic Awareness Week last year, we had the different collegial bodies as well as the agencies actually sign a document of support for the AMR campaign. Okay. And for this year, we will have a simultaneous kickoff activity in November 12, where in the different regional offices we'll have an activity just for the AMR. And in November 19, we will be officially launching the iAMResponsible campaign, and we will have a press event, or we call it the Kapihan event, during that event. Okay, so and this will be the tarpaulin that each regional office will be unfurling when there will be a statement of support from the regional executive director. Okay, and we also have a jingle making contest, which we will launch. We have launched also, and it is ending soon. Okay, so these are the joint AMR activities during AMR Antibiotics Awareness Week in the different regions, and we will have a joint celebration of AAW with the DA and DOH along with the stakeholders. And finally, this slide. Okay, so this seems to be a slide which has random people from the internet, but no. Because in the AMR campaign, whenever we go around, we would ask the opinion of others. What do you think about the AMR? And some stakeholders would say, parang impossible. It seems impossible. But let me show you this slide, okay? The first one is George Kirk. In 2023, served as a captain for 12 minutes in the USS Kelvin, saved 800 lives, and he saved his wife and his newborn son. I'm talking as if this person is a real person, but he's from Star Trek, okay? So let's go more into reality. Wolfgang Amadeus Mozart, by the age 5, he performed before European royalty, died at age 35, but before he died, he composed 600 works which are pinnacles of music, okay? But what he did is some sort of stuff of legend, right? I'll go more into reality. I hope you recognize this guy over here. It's Manny Pacquiao, okay? He grew up in a shanty town sleeping in cardboard boxes. His parents separated in 6th grade. He dropped out of school due to extreme poverty, okay? He went professional at age 16, and now he is the only 8 division world champion in the world. And my next slide, and my last slide is a picture of my daughter pretending to order pizza. I always show this because, for me, this fight is a personal fight, okay? So the little work that I do in AMR now, I know somehow will define how she lives in the future. So in whatever advocacy that we have, let's make it personal, because this fight is for our children's children's children. Thank you very much.